Good morning to all. I am Dr. Sudhakar. I am going to present a tear film osmolarity as a diagnostic tool in management of microbial keratitis. And there is no financial disclosures for the content of this talk. And tear film microbial keratitis is a major global cause of visual impairment and blindness, especially in rural areas of India. And proper diagnosis is important to detect the causative organisms, so we can give the successful treatment. And awareness and access to microbial test is very limited in our cities and not universally available also. So a role of point of care test is very important for a proper diagnosis and successful treatment. Brief discussion about tear film osmolarity. Tear film osmolarity is an index of the tear film dynamics, and it is determined mainly by the electrolytes of the aqueous phase of the tear film and with some minor contributions from the proteins and sugars. Normal tear film values are 290 to 305 milliosmoles per liter. Anything below 300 is normal only, and above 300 is the disruption of the tear film. Coming to hypothesis, the fungal invasion of the corneal stroma upregulates the cytokines and matrix metalloproteinases. These cytokines and matrix metalloproteinases increase the tear film osmolarity, and also there is morphogenic switching of the yeast to hyphae. When compared to bacteria, the fungi are larger in size, so there is more inflammatory response in the bacterial and other infections. This cytokines and MMP9 upregulation results in increase in tear film osmolarity. The aim of this pilot study was to evaluate the diagnostic value of tear film osmolarity in diagnosing and differentiating microbial keratitis caused by the bacteria from the fungi. Methodology: total 42 cases were included in this study, and they are grouped into two groups caused by bacteria and fungi. And tear film osmolarity test was done 2 hours after the confirmation of the causative microorganism by smear examination. Why the 2 hours is needed is if you apply any medications before 2 years, it will alter the osmolarity values. That's why after 2 years we have to do the test. And one more thing is, if the patient is dilated or if you put anesthetic drop, at least 15 minutes duration should be there. After 15 minutes only you have to do the test, otherwise the osmolarity values are not accurate. This osmolarity was checked with tear lab equipment, and the osmolarity values were noted and grouped into two according to bacteria and fungal infections. The brief review of procedure. First, this tear film osmolarity kit contains the test kit and test pen as well as tear film osmolarity system. First, we have to attach the test card to the tear film osmolarity pen, and successful attachment is indicated by the green light. And after attaching this one, you have to remove the protective sleeve. And after removing the protective sleeve, ask the patient to look up and in. So then place the test card just nearer to the lateral canthus without touching the sclera. So it will automatically, the test card automatically absorb the tears, and it show the values. The successful absorption is indicated by the click sound. And after absorption, we have to keep we have to dock the test kits on the tear film osmolarity system, and within 40 seconds of obtaining the tear film. And the test card has numerical values. After docking it onto the osmolarity system, we have to enter the correct numerical value, then only it will show the correct reading, and within few seconds the osmolarity values are displayed on the screen. This is the brief overview of the procedure. Now coming to results, the group A having bacterial keratitis has 22 cases, and group B have fungal keratitis 20 cases, and age and sex were equally distributed between the two groups, and we used one-way ANOVA calculator to compare the results to differentiate the osmolarity values between bacterial and fungal infections. And in all the cases, there is consistently higher osmolarity values in fungal infections when compared to bacterial infections, and the p-value also significant. Coming to conclusion, the tear film osmolarity values are consistently beyond 320 milliosmoles per liter in all the cases of fungal keratitis, except one case. That case has severe dry eyes also associated values. And diagnostic value and it is also useful for diagnostic value and differentiating infections between bacteria and fungi. The limitations is we need to have a larger sample size to add value to our conclusion. But when compared to other studies, they done the tear film osmolarity values only in dry eye cases. But this is one of the first few studies explore the role of tear film osmolarity in microbial keratitis. The limitations of study is no control group are high because of high expenses, and the sample size is also small, only 42 cases. The strengths of the study are no other studies in literature explores the relation of this diagnostic value in microbial keratitis. There is a good potential of point of care test for general ophthalmologists. These are my references. Thank you.
I think without a control group of the other eye, the high values or low values actually don't.
But normal values, we are comparing with the normal values.
Lewis, you have written microbial keratitis, and most of the studies are done in fungus.
Yes.
So that's what madam is telling, like the comparative group. Normal group, then
Even
you
the
can
other eye actually they would have tested and said that
other
okay, this is higher than
that.
that
Yes.
Comparison with the other eye control should be required.
Yes, sir.
You can change the study to a control group.
Control group, yes, sir, definitely.